I'm Holly Hopper with the Kentucky Alliance for Drug Endangered Children. The Drug Endangered Child Movement is an effort that brings together multiple groups of professionals to respond to the needs of children who are found, identified to be living in homes where drugs are produced, sold, or used. Methamphetamine is the drug that has brought to the awareness of the nation the dangers of drug use on children. We now know that children will test positive for drugs when drugs are smoked or cooked in the home, particularly methamphetamine. We also know that children in homes where cocaine is used will test positive for that drug as well. Through the partnership of multiple state and federal agencies and local groups that involve prosecutors, law enforcement, child protection agencies, mental health professionals, school professionals, and public health nurses, to name a few. The people who can respond to the needs of children are brought together and able to communicate about what they see in the community and what needs to be done to respond to that need. The response teams are comprised of individuals who, because of their position, their employed position, will encounter drug-endangered children or parents who might be at drug involved. It is those people that we rely on to identify who the children are, to get them the medical needs, medical assessment and follow-up that they need, the mental health services that they need. We now know that many child victims are at risk of developing substance abuse problems in later life. They also are more likely to become criminal offenders themselves as juveniles and also as adults. That is something that we have an opportunity to prevent. The education teams in the community are the people that we charge with providing the information to the community. It's important that communities know the criminal involvement that occurs in the community and why that's a problem. Typically or historically, we've really viewed drug crimes as a victimless crime. With the methamphetamine epidemic, it has become increasingly clear to us that drug abuse and drug sales and drug production are not victimless crimes. Children can be victimized by this behavior. Elder adults can be victimized by this behavior. And it is our responsibility as professionals and members of a community to work together to protect those. We have made a lot of progress in the state, in the nation. Certainly a lot of progress has been made to address the needs of the drug-endangered child. However, much more is needed. We need to learn more about the long-term effects of the chemical precursors and the chemical manufacture of methamphetamine. We know that there are acute exposures where the effects are very obvious. An acute case would be a situation in which someone could eyeball someone and determine whether or not they have serious burns and whether that child needs to be transported and get immediate service. A chronic case, however, is one in which exposure might have been occurring, might have taken place over the course of a year, maybe 2 years. The damage is internal, and the child may look fine, they may appear fine, they may be able to speak and communicate with you. They may not have any physical complaints. But what we know, because of the chemicals that are used to produce methamphetamine, is that there is a risk of cancer associated with many of these chemicals. There is a respiratory risk. And it's very, very important that children be tested and have the follow-up medical examinations necessary to identify early on potential cancers or other respiratory issues, so that we can learn more about providing for the long-term healthcare needs of the children. Their care has not been a priority to individuals. They learn that people hurt them. That's their experience. So it's very, very difficult for those children to bond and for them to become productive members of society. We hope that in our future work we can provide better for the mental health needs of these children and for the better outcomes of communities in our state.